Welcome to Obstetric and Gynecology Forum. I'm your host, Dr. Olabola Olaniyi, your obstetrician and gynecologist. Today, we shall be discussing an important topic in gynecology. This topic is very important because it contributes significantly to our women's health. Because this particular topic affects our women in such a way that it contributes significantly to their hospital visits and consultations. It contributes significantly to their reproductive health, menstrual health, pregnancy and childbirth. Today, we are discussing fibroid. What is fibroid? Fibroid simply means smooth muscle tumor of the uterus. That is the tumor of the womb. What are tumors? Tumors simply means abnormal growth. Abnormal growth which may occur in any part of the body. But fibroid is an abnormal muscle growth that is localized to the womb of a woman. And it happens to be the commonest tumor in women as within and outside the uterus or the womb. This tumor is so important because of its effects on our women. This tumor is also so important because there is a lot of misconception about this particular condition. And it's also very important because it's a disease of black women. Now, it has been found that up to 1 out of 5 women at the age of 30 have this tumor within their womb. And this tumor is very common between the ages of 35 and 45. This is the age range during which a woman is very actively involved in reproduction when they are getting pregnant and they're having their children. And as a woman approaches the age of 50 years, half of women have these tumors within their womb. However, it's important to know that as common as this tumor is, up to 2/3 of women with this tumor will not show any symptoms. So women carry this tumor around without even knowing it, and some of them are discovered incidentally during examination, sometimes for other conditions. Now, women usually ask, why fibroid? Why do I have fibroid? How did it occur? Where is it coming from? That is a very common question that we get in the gynecology clinic. What is the origin of fibroid? Studies have been done to try to get to the root of why fibroids occur. But it has been found that, as I said, it's a tumor that occurs only in women. And because of certain factors, we found out that this tumor does not grow before a woman starts menstruating. It grows faster, sometimes during pregnancy. It grows in women during their reproductive age group. And after women stop menstruating, these tumors stop growing. So invariably, that means this tumor has been found to be associated with the female hormones, estrogen, the hormones that make them to be able to reproduce. So, and it has been found that the receptors where these hormones can attach are found higher around and within the fibroid, beyond what we found within the muscle of the uterus. Now, some other genetic studies have also shown that some particular chromosomal abnormalities, which are inborn genetic issues in the body, the genes are the building block of every cell in our body. So some of these dysfunction or changes in these genes have been associated with the formation of fibroid. And some hormones, they are chemicals that we call growth hormones that make tissues to grow, has all been found in high concentration within the fibroid. All these things linked together is pointing to the fact that fibroid may occur in a woman or reproductive age group due to their linkages to the hormones in the woman. And it's been found that in some cases it has been found to occur within families. So that means there is a strong genetic implication. to the formation of fibroids. Now, fibroids may occur, like I said, they occur from the muscle of the womb. They are part and parcel of the womb. Fibroids don't come from outside and attach to the uterus. This is a pictorial representation of the womb and the fibroid. The fibroid usually grows from the muscle of the uterus. So it's part and parcel of the uterus. They are just cells of the uterus that have decided to grow abnormally and faster than the other cells of the uterus. So they are part and parcel of the uterus. Now, it has been found that fibroids are commoner in women that have not been giving birth. We call them nulliparous, women that are in the reproductive age group that have not been giving birth. And they are commoner in women who don't ovulate regularly, who don't release eggs regularly, and women that have infertility, or women that have low numbers of babies as against women that have many children. It's a common pattern that a womb that doesn't carry babies will carry uterus. So, and it's been found that some certain hormones like estrogen given to women to treat other conditions in high concentration may be implicated in the formation of fibroids. Ridiculously enough, smokers have low incidence of fibroid. That is not to say that we should encourage our women to smoke cigarettes. Now, how do we classify fibroid? Looking at this diagram, this is the diagram of a womb. If you look at this striped portion, we are trying to bisect the uterus. We cut it open. The uterus is like pear. We are trying to cut it open. And cutting the uterus open, looking from the front, this part is the part that was cut open. This part is the cervix of the uterus. This is what we call the broad ligament. This is the cervix, which is the gateway into the womb. This is the part that we refer to as the vagina. These are the muscle. This part is the muscle. And this area with red and blue indentations are the fibroid nodules, what we call fibroid nodules. Now, how do fibroid develop? Fibroid develop from the muscle of the uterus originally, and this is an example of a fibroid that developed within the muscle of the uterus. Now, but as the fibroids continue to grow, because fibroids grow, although their growth may not be rapid, before they grow to a level where you be able to notice them that something is growing, it may take 3 to 5 years. But they grow, and the growth varies. Some grow rapidly, some grow slowly, some are large, some are big, some are multiple, some may occur singly in the uterus. Then when they start to grow, some may grow towards what we call the endometrium. The endometrium is the lining inside the womb. That lining is where pregnancy attaches for baby to grow. That lining is where the menstrual blood, the blood that comes out during menses, that is where it comes from. That is where it is shed. Now, this is the endometrium. When the fibroid grows towards that lining of the uterus, we call it submucous. Just that means it's growing under the endometrium, under the lining of the womb. And this is a pictorial representation of that. You can see that this fibroid is bulging into the endometrial cavity. It's already deforming this place. This place is supposed to be opened uniformly. This is bulging to it. Now, this is what we call submucous fibroid. That means it's growing underneath the endometrium. Now, with further growth, it can continue to grow and detach completely from the uterus and attached by a narrow rope, or what we call a stalk, to the endometrial cavity. They call it an endometrial fibroid polyp, or a pedunculated fibroid. Usually you call it a polyp. It's attached, and after being attached, it may still remain within the uterine cavity. Or sometimes, if the growth is around, if the fibroid is from the cervix or lower part of the uterus, it may grow through the cervix, which is the entrance into the uterus, and protrude into the vagina. These are all polypoid fibroid tissue. Now, if it grows toward the cervix, the outer surface of the womb, and grows under the surface, what we call the lining of the surface is called the serosa. If it goes toward under the lining of the uterus or the womb, we call this subserous or subperitoneal fibroid. It may continue to grow and also acquire a stalk like the polypoid mass, acquire a stalk on the surface of the womb. We call it pedunculated fibroid. It will be joined to the uterus by a stalk. In rare occasions, on rare occasions, this fibroid, because it's very close to the intestine and the omentum are the fats within the abdominal cavity, it may attach to the omentum or the intestine and get detached from the uterus and occur separate from the uterus. We call such fibroid parasitic fibroid or wandering fibroid. They are completely detached from the womb. Now, some fibroids can grow within the substance of the cervix and make it bigger. It can grow within the substance of the cervix, either within the vagina or above the level of the vagina. These also have their own implications. Now, like I said, this may grow from the cervix or the uterus, the endometrial cavity, and protrude into the vagina. And this part is called the broad ligament. The broad ligament is a thin sheet of tissue that connects this side of the uterus, the fallopian tube, to the side of the pelvic wall, to the side of the abdominal wall there. Between this, and there are two sheets. Between those sheets, the fibroid can grow like this and go in between those two sheets. We call it intraligamentous fibroid. It also has its own implication, which will be discussed subsequently. So, by and large, you've been able to discuss fibroid can grow within the muscle of the uterus, can go underneath the layer or lining the cavity of the uterus. It can grow underneath the layer lining the surface of the uterus. It can attach a stalk and become pedunculated outside on the surface. It can attach grow a stalk and become pedunculated or polypoid within the uterine cavity, or may even come out through the uterine cavity and may grow beyond the broad ligament. These are different areas where fibroids may grow, and they have their own different implications. Now, talking about changes, because fibroids are with muscle within muscle of the uterus and they attach their blood supply, because every living tissue needs blood and oxygen and nutrients to survive. So they get their nourishment from the muscle of the uterus. But because these mass are very hard, they are not like normal tissue, blood can only grow to a certain extent into the substance of this tumor. So usually the blood supply is on the surface. So during different changes during the menstrual pattern of the woman, during pregnancy or during menopause, some changes may occur in the muscle of the uterus, in the blood supply of the uterus, that may deprive the fibroid of blood, or change the blood supply to the fibroid. So because of that, the fibroid can undergo different changes. We call it secondary changes in the fibroid. Now, some of these secondary changes include degenerations. Degenerations means something uh, like decomposing. Now, aside degeneration, it can undergo what we call atrophy. It can become necrotic. Necrosis means death of cells. It can atrophy. That means it can reduce in size. It can get infected. The blood supply can change and get disrupted, which we call vascular changes. And in rare cases, fibroids can become cancerous. Like I said, they are not cancers. They are just abnormal growths. They are not cancers. Now, studies have shown that cancers can also occur within the muscle of the uterus. Now, determining whether the cancers are growing from the fibroid or they develop on their own has been subject of a lot of research. But it's been assumed that fibroid can also grow in rare cases to become cancerous, especially when you have fibroids that grow so rapidly associated with pain, or fibroids that grow after a woman has gotten to menopause. Like I said, these fibroids regress or reduce in size following menopause. If a fibroid start growing rapidly after menopause, we start suspecting such fibroids, or if they are associated with some other complications. So the fibroid technically, theoretically, can become cancers, but that one is rare. It's 1 out of 1,000 cases or 1 out of 100 can become cancerous theoretically. So those are the changes that may occur in fibroid. Okay, now those changes, how do they occur? Let's take degeneration for instance. There is what we call early degeneration. These fibroids, like I said, are harder than the substance of the muscle of the uterus. They are hard, and looking at it, they make the uterus irregular because of where they are located. But during the early degeneration, what happens is that this part will become very soft. It becomes very soft. So from there, it can become what we call cystic degeneration. The soft part become decomposed and become like gel and become soft like gel. So we call that one cystic. And when you look at that on ultrasound, it look like there are spaces within the womb. They are like empty spaces because the substance the inside is dissolved. These changes are very common towards menopause. Sometimes when the woman has just delivered and the hormonal changes occurs after delivery, or when the woman is about to enter menopause or has entered menopause. Menopause means a period when a woman is old and menses will stop flowing. Now, this place become like cystic spaces. There are spaces. The cystic spaces may now become fatty. Fatty tissue, fat dey now organize within this substance. We call it fatty degeneration. And aside that, within this substance, calcium deposits like salts, like crystals, crystals may deposit itself within this substance, sometimes on the surface, especially in what we call pediculated fibroid. They get calcific deposited with calcium, and they become on an X-ray you see like stone, white like stone. So we call that one calcific degeneration, also commoner following menopause. Now, there is something we call necrobiosis or red degeneration. That degeneration occurs usually in pregnancy. Like I said, it has a lot of effect on pregnancy. Now, a woman that has fibroid and is pregnant may have what we call red degeneration, because as the uterus is growing, the blood supply within the uterus may not be sufficient to supply the fibroid to the interior of the fibroid. So what happens? Because there is no oxygen and blood supply, some part of the fibroid dies off and will be associated with severe pain. If pain is not well managed, the woman can start contracting. This usually happens in the second half of pregnancy, not in the early stages. When the pregnancy has gone beyond the first 5 months, that is when this usually occurs. We call it red degeneration associated with severe pain in a pregnant woman. So when that occurs, the woman will need to be admitted, given some analgesic, and because the pain and the changes can make the uterus to start contracting, which can lead to abortion or premature delivery, the patient will be admitted and managed accordingly. So that's by and large, that's about the degenerative changes that may occur in the fibroid and where and when they occur. Now, we have talked about atrophy. Atrophy means a reduction in size without taking any drugs. Without any intervention, fibroid may actually reduce in size. Now, what happens is the size will go down. Usually, following pregnancy, it may occur, and following menopause, they can atrophy, they can reduce in size. That's one of the things. Then they can become necrotic. Necrotic means part of it may die. This part of the fibroid may die off. Then another common change in pregnancy, we call it necrosis, infection. This fibroid that is under the surface of the uterus, because of friction, may become opened. This part may become ulcerated. We call it ulceration, like there is a wound on the surface. Through that wound, infection can go into the substance of the uterus and it can become severe. It can cause a lot of problems for the woman. So infection can occur within the substance of the fibroid. Then the vascular changes also within the fibroid, the changes of blood supply to the fibroid may become so extensive that blood flow to this place may be compromised, and this place will become enlarged and filled with blood sources, and it can also lead to bleeding. We've seen cases where fibroid will continue, will start bleeding, and the bleeding will be within all over the abdominal cavity. So bleeding can occur, and like I said, the transformation of fibroid to cancer, which we call sarcomatous changes. Those are the common changes that may occur in fibroid. Now, how what do you notice that will make you think, hey, as a woman that probably I'm suspecting that I have fibroid, what are the symptoms that you may notice. Now, like I said, it's a disease that is commoner in women that are not pregnant, that have not been having pregnancies. But that does not mean it cannot occur in pregnant women. So outside pregnancy, fibroid may be discovered. So one of the commonest symptoms of fibroid is bleeding. Bleeding generally is very common in fibroids, and the bleeding are what we call abnormal uterine bleedings, and they may come in different forms. Now, a woman menstruates every month, and that menses usually occurs between 3 and 7 days. Usually, in fibroid, the volume of bleeding may increase, and the volume of bleeding, a woman that uses 1 or 2 pads per day may end up using 4 or 5 pads a day. The bleeding may be associated with passage of blood clots, and the duration of bleeding may increase. A woman that was menstruating for 5 days may start menstruating for 8, 9, 10 days. So that is what we call menorrhagia. That's every menstrual flow may occur as a result of uterine fibroid. The other form of bleeding that may occur is what we call intermenstrual bleeding, what we call metrorrhagia. Now, a woman that has finished menses may start noticing spotting before the next menses, and that may be disturbing. So some women have finished their menses, just all of a sudden they start noticing bleeding or spotting again. Another one that may occur is some spotting that may occur before the actual menses, for some days before the menses, just light stained blood may just be coming out through the vagina. So bleeding is one of the commonest presentation of it. We are not saying that any form of uterine bleeding is not only due to fibroid. There are other causes which must be ruled out by your doctor. The bleeding is the commonest presentation of uterine fibroid. Then pains. Like I said, pain can occur during generation, like red generation, which may be associated with pains. Then pain may occur because the uterus is trying to expel, especially when fibroid nodules are within the cervix or within the uterine cavity. The uterus may be trying to push out the fibroid, which may be associated with pain. So some of the changes also may be associated with pain. And women may have pain during menses, what we call dysmenorrhea. Because of this fibroid, some women have painful menses. Some women, because of fibroid located within the vagina and around the pelvis, and sometimes because of the congestion that occurs, may have painful sexual intercourse, what we refer to as dyspareunia. Some women may have pain during their menses. So basically, pain can occur. And another symptom the women may present, some women will notice that there is a mass in their abdomen, especially in the lower part of the abdomen. They notice there is a mass, there is a swelling, there may be a feeling of heaviness in the pelvis. So that may also occur. And because of the presence of that mass, because in the pelvis there are also other structures like the bladder, the ureter that carries urine from the kidneys, and the part of the bowel where the fecal matter are stored before being passed out during defecation. So the pressure effect on those structures may also occur. Women may have frequency of urination. Women may have sometimes urinary retention. They are not able to pass urine out because of the effect of the mass. Sometimes they have what we call constipation. They feel constipated, fecal matter is there, they feel you have the urge to go to the toilet, but the fecal matter is not coming out. So those are some of the things that a woman may notice. And in pregnancy, like I said, pains in pregnancy may occur. Then pain from torsion. This fibroid that is pediculated, this top can twist and cause a lot of pain. So pain from torsion and so on and so forth. So those are things that a woman may notice. If you notice any of these symptoms, please present to your gynecologist, who will review and examine you and tell you. Because what is important now is this: some of these symptoms may not be due to fibroid alone. Now, for a woman that feels a mass in the abdomen, there are other structures in the woman's abdomen that may give rise to a mass that may be more worrisome than fibroid, like ovarian tumors. Ovarian cancer can give you a mass in the abdomen. So how do you differentiate between an ovarian tumor and straightforward fibroid? Now, when a woman is having abnormal bleeding through the vagina, how can you differentiate between the abnormal bleeding from fibroid from bleeding from cancers? Cancer of the cervix, which is the gate to the womb, which is very common in our women. Cancer within the endometrial cavity, that is the lining of the womb, or even cancer in the muscle of the womb, or cancer in the tubes. So how do you differentiate? You have to see your doctor. And pains, so many other things can cause pain: adenomyosis, endometriosis, and some other pelvic conditions can also be associated with pain. So when you notice any of these conditions, present to the hospital, see a gynecologist who will review and make adequate and appropriate diagnosis of the condition and manage accordingly. Now, what have we been able to achieve today? We are going to stop here today. From next week, we are going to talk about how to make diagnosis of uterine fibroid. What are the likely differential? What are the other things that can mimic the presence of uterine fibroid? What are the complications that you may notice when you have fibroid, and how do you manage? But by and large, today we have been able to tell us what fibroids are, and today we've been able to say that fibroid is a disease of women of reproductive age group and is commoner among black women. And we have been able to say that because of the complications and the presentations that may occur, this topic is very important. But if you notice of any of those symptoms that we have highlighted, please try and see your gynecologist for further review, examination, and subsequent management. Thank you very much. We are going to stop here today. In our next discussion, we talk about the other part of the fibroid. If you have any comments or questions, please don't hesitate to get back to us. Thank you very much.